Hello, I'm Dr. Melita Tate with Grassroots Healthcare, and I want to speak for a moment to those of you interested in bioidentical hormone testing. Bioidentical hormones are hormones that differ from the pharmaceutical traditional hormone replacement therapy in several ways. The first is that they're plant-based, meaning they're made from plants and are more natural. The second is that they match identically the chemical structure of the human hormone. There are no extra side chains that need to be metabolized, unlike the traditional hormone replacement therapy. This is important because we know that hormone replacement therapy goes through the liver and is capable of causing benign liver cysts. The bioidentical hormones are oftentimes absorbed directly through the skin or mucous membranes and bypass the liver completely. Now, it's a well-known fact that hormone replacement therapy caused blood clots in patients who smoked. Oral contraceptive pills, hormone replacement therapy, we were taught in medical school to never give these to smokers due to the increased risk of clotting. That surprises me that there was such an uproar when the studies were done that hormone replacement therapy increased risk for heart disease and stroke, when that was already a well-known fact. Now, the main difference between the two is that bioidentical hormones act on all three estrogen receptors that we know of. There's estrogen 1, 2, and 3 receptors. And the traditional hormone replacement therapies that are prescribed by physicians and manufactured by pharmaceutical companies act only on estrogen 1 receptor. Estrogen 2 and 3 receptor has been found to protect against cardiovascular disease and other age-related changes in the body, including dementia and age-related changes in the brain. In fact, many of our age-related changes may in fact be due to our hormones and the decline that we experience. Now, we know that there's a natural decline that people have with hormones, and a lot of times as we start getting out of balance with our hormones, these changes that we get with hormonal imbalance get dismissed. But myself, as well as many other physicians on the front lines of primary care, are starting to realize that there's quite an uproar going on in people's neuroendocrine system. That's the system that controls our glands, among other things. Biochemical feedback in the brain is also included in that long neuroendocrine system. The endocrine system mainly is comprised of the glands in our body. So diabetes, the diabetes epidemic that we're having has to do with the pancreatic glandular tissue malfunction. And it's well known that we're having problems there. What might not be as well known to the populace is that there are increasing numbers of patients experiencing thyroid disorder. And in that case, we usually put the patient on a thyroid medicine and they do much better. However, when your hormones become out of balance, you experience some non-specific symptoms that could be caused by several other things. These include, but aren't limited to, fatigue, sleeplessness, and everyone knows with hormones about night sweats and declining sexuality. Heart palpitations, anxiety, depression, irritability, hair loss, weight gain, muscle mass loss, and then changes in the menstrual cycle are just some of the changes that you can experience with hormonal imbalance. This is important because as these things are nonspecific, a lot of times patients will get put on, say, a beta blocker, which is a blood pressure medication to control their heart palpitations, or an anxiety medication because they're having chest pain and heart palpitations and they're diagnosed with either anxiety or depression. And as we heard in one of our famous hormone lectures, was if the patients are never deficient in Xanax, but they could be deficient of a hormone. And what is so much better is that we're able to treat with something that matches what our body chemistry looks like, rather than a pharmaceutical drug that no one is deficient in. These pharmaceutical drugs are just patches and they don't get to the root of the problem. So I encourage my patients to look into getting bioidentical hormones checked, or getting their hormones checked, and see if they need replacement in the bioidentical hormone arena, or if they need some sort of support mechanism so that their own um, hormonal system can recover. Other glands that we're starting to see problems in are the adrenal glands, and all of these glands are a part of a very intricate, balanced system, and it's very difficult for physicians to know exactly where you fall on the scale of normal. There's quite a wide range of normal for each estrogen, progesterone, testosterone, and so sometimes patients may be in the normal range but on the lower end of normal, and this may be a change for them. Unfortunately, we won't have their previous hormone levels to check, and so it's hard for us to figure out where we need to make adjustments. And as physicians, we've been kind of taught that if they fall in the normal range, then they don't have the disease process and to look no further. But many times, if we'll take a moment and look at our patient's symptoms, and then push them into the upper third of normal, say, or mid-level normal, and see if their symptoms improve, then we're more going about the practice of medicine rather than just giving a knee-jerk answer and moving on without treating the patient. So I encourage all my patients and any viewers I have experiencing those symptoms to consider getting bioidentical hormone testing. We have it available at our clinic through saliva testing. Some physicians are uncomfortable with saliva testing. Most of us were taught originally to go off of blood levels and are more comfortable with that. The reason that most physicians cite that saliva testing isn't good is that there are a wide range of normal within a day, a wide range of different test results within one day on the same person. Yes, that's true. And as we were taught in medical school, so do our hormones widely fluctuate during a 24-hour period. The test kits that we have ask to check your saliva 4 times during the day. And then we mail these off and have the lab analyze them. So you can order those through us if you're interested in getting your hormone levels checked. It's a good place to start if you have any of the symptoms that we mentioned before. In the packet that we send out to you, there's a questionnaire with all of your symptoms because that's a highly important piece of how we treat our patients. And then there's also a label so that you can just send the box back in. It's a prepaid label so that you can just mail it in. Your results will come to us and then we'll send them out to you. If you would like, then you can either come in, make an appointment to go over your test results with us. There'll be some suggestions on there of things you can do to support your endocrine system on your own with different kind of supplements or foods. Or I encourage you, if you're out of state or where you can't get to us, or you have your own doctor who's familiar with bioidentical hormone replacement, to take the results to them and have them go over it with you, looking at your symptoms and looking at you as a patient and see what needs to be treated. So if you're interested in that, we have an availability on our website to order that. You can order it through PayPal or use your credit card. Just simply fill out the form and contact us, and we'll get that mailed out to you and get the results back to you. So thank you for watching.